Emily Richards Rowland, and she is with the Bureau of Labor Statistics. And so I am going to pull up her webinar, and we will go ahead and get started with our presentation.
Okay, thank you, Angie. As Angie said, my name is Emily Richards Rowland, and I work as an economist with the Bureau of Labor Statistics. I've worked in the Division of Occupational Employment Projections since 2011, where I serve as the team lead for healthcare occupations. So today we're going to be talking a bit about some background information on the employment projections data, and then we'll take a closer look at several of the allied health occupations before walking through some of the material that's available on our website if we have time. So let's get started here. So every 2 years, the BLS releases long-term employment projections for the nation. We don't produce projections by state or area. Each state produces their own projections, though, using BLS data. Those state and area projections are available on Projection Central. We'll have a link to those data at the end of today's presentation. So, total employment for the nation is projected to increase by 6.5% from 2014 to 2024, adding about 9.8 million new jobs. Healthcare support occupations and healthcare practitioners and technical occupations are projected to be the two fastest growing occupational groups, adding a combined 2.3 million jobs, and that accounts for about 1 in 4 all new jobs over the projections period. Projections data are featured in our Occupational Outlook Handbook, which is the government's premier source for career information. The 2016 to 17 edition of the OOH, which was released this past December, includes 329 occupational profiles covering 576 detailed occupations, which accounts for about 83% of total employment in 2014. In addition to employment projections data, each of our job profiles features information on job duties, where workers are employed, wages, education and training that's typically needed to work in an occupation, as well as any licensing and certification that may be needed. Occupations have typical pathways, which include education and other types of preparation. Not everyone working in an occupation needs the same level of preparation for entry, so it's our job, the BLS, to determine the most typical path for entry, along with any regulatory requirements. This presentation will mostly cover occupations where the entry path typically includes a post-secondary credential of less than a bachelor's degree. So that includes an associate's degree, which we define as completion of a degree that usually requires at least 2 years, but not more than full years of full-time academic study beyond high school, and post-secondary non-degree awards, which we define as programs that lead to a certificate or other award, but not a degree. These programs last only a few weeks, or they may last up to 1 to 2 years. Some occupations also need additional preparation, such as on-the-job training and related work experience. Most healthcare occupations are regulated by the states, as you know. Many of the healthcare occupations covered in this presentation require a license, certification, and/or registration. When we look at licenses, we're describing licenses that are typically issued by states to ensure that workers have met specific legal requirements to practice in an occupation. States have regulatory boards that set standards for the practice of a licensed occupation, but rules and eligibility may vary from state to state for the same occupation. Some occupations are certified. These certifications may be required or optional and demonstrate competency in a skill or set of skills. Certifications are usually offered by professional organizations. And lastly, here we have registrations, which are typically required or issued by states or local governments. Workers seeking registration may need to be licensed or certified. In most cases, workers must pay fees to receive or maintain their registration. We always advise that candidates should check with their health boards in their states, as requirements often vary by state. So now we're going to take a closer look at several groups of occupations. You can see here that our first group is the dental occupations, which consists of dental hygienists and dental assistants. Dental assistants typically need an associate's degree, and programs typically take about 3 years to complete. All states license dental hygienists, and in most states, a degree from an accredited dental hygiene program and passing grades on written and clinical exams are required for licensure. To maintain a license, hygienists typically must complete continuing education requirements. Dental assistants typically need a post-secondary non-degree award. Dental assistants who do not have formal education in dental assisting may learn their duties through on-the-job training, though this is a less common pathway through entering this occupation. Some states require licenses, registrations, or certifications. States that allow assistants to perform expanded duties, such as corneal polishing, require that they be licensed, registered, or hold certifications from the Dental Assisting National Board. Some employers also may require certain certifications, including CPR certification. So for each occupational group, we'll show a table like the one that you see here. Each table includes the level of employment in 2014, as well as the level of employment in the projected year of 2024. We're also going to show the numeric and the percent change over that period. This column here shows job openings, which includes an estimate of both new jobs from growth as well as job openings that stem from the need to replace workers who retire, change occupations, or leave the labor force. And then in the last column, we have 2014 wages. So you can see here that dental hygienists are projected to add 37,400 new jobs. All of the data here is in thousands. And hygienists earned a median wage of $71,520 in 2014. Dental assistants are projected to add 58,600 new jobs, with median annual wages of $35,390. Next, we have emergency medical technicians. This occupation typically requires post-secondary non-degree award to enter. Programs provide training at 3 levels: EMT, Advanced EMT, and Paramedic. Advanced EMTs have more instruction hours than EMT Basic. Paramedics are the most advanced level and may need an associate's degree. Paramedics typically complete EMT and Advanced EMT levels of instruction, along with additional courses in advanced medical skills. All states require license, and certification may be required prior to licensure. In most states, an individual who has the National Registry of Emergency Medical Technicians certification qualifies for licensure. In others, passing an equivalent state exam is required. So here we have the data for EMTs, and you can see that the occupation is projected to add 58,500 new jobs by 2024, and EMTs typically earn a median wage of $31,700. Our next group consists of 5 diagnostic imaging occupations. We have cardiovascular technologists and technicians, diagnostic medical sonographers, nuclear medicine technologists, radiologic technologists, and MRI technologists. All 5 occupations typically require an associate's degree. MRI technologists often begin their careers as radiologic technologists and may become MRI techs after gaining several years of work experience. Few states require a license or certification for cardiovascular technologists, for diagnostic medical sonographers, or for MRI technologists. About half of states require a license or certification for nuclear medicine technologists, and most states require a license or certification for radiologic technologists. Even in states where these workers are not regulated, employers typically prefer to hire candidates who have certification. So here we see the data for these 5 diagnostic imaging occupations. You can see that cardiovascular technologists and technicians are projected to add 11,500 new jobs, and they typically earn a median wage of $54,330. Diagnostic medical sonographers are projected to add 16,000 new jobs, earning a median wage of $67,530. Nuclear medicine technologists are projected to add just 300 new jobs. However, that occupation earns the highest wage of any in the diagnostic imaging occupation group at $72,000, just over $72,000 a year. Radiologic technologists are projected to add 17,200 new jobs, earning $55,870 a year. and MRI technologists are projected to add 3,500 new jobs, earning a wage of $67,090 per year. Our next group is laboratory technician occupations, which consists of medical and clinical laboratory technicians and phlebotomists. The first, medical and clinical laboratory technicians, typically need an associate's degree, and some states require licensure. Certification of these technologists is required for licensure in some states. Although certification may not be required to enter the occupation in all cases, employers typically prefer to hire certified technicians. Medical laboratory technicians can obtain a general certification as a medical laboratory technician or certification in a specialty area. Phlebotomists typically need a post-secondary non-degree award. Some phlebotomists enter the occupation with a high school diploma and on-the-job training, though this is less common than the post-secondary non-degree award pathway. Phlebotomists are not licensed. However, again, like the other occupations we've discussed, employers typically prefer to hire phlebotomists who have earned a certification. Medical and clinical laboratory technicians are expected to add 29,000 jobs through 2024, earning a median annual wage of $38,370. Phlebotomists are projected to add slightly fewer jobs with 28,100 and a median annual wage of $30,670. Moving on to the direct care occupations, which we define as licensed practical and licensed vocational nurses, LPNs and LVNs, nursing assistants, and medical assistants. Some medical assistants enter the occupation through a less common pathway of a high school diploma and on-the-job training, but typically LPNs and medical assistants both need a post-secondary non-degree award. LPNs and LVNs must be licensed. After completing a state-approved educational program, prospective LPNs and LVNs must take the National Council Licensure Exam, the NCLEX-PN. Nursing assistants must be on a state registry. Nursing assistants must complete a state-approved education program and pass a competency exam to be eligible for the state registry. In some cases, nursing assistants can earn additional credentials, such as becoming a certified medication assistant. Medical assistants are not required to be licensed in most states. Some states may require assistants to graduate from an accredited program, pass an exam, or both. Employers often prefer to hire certified assistants, and several organizations offer professional certification. You can see that LPNs are projected to add 117,300 new jobs over the projections period. You'll note that half of these jobs, more than half of these jobs, will stem from the need to replace workers. And we can see that with the total job openings at 322,200. The median annual wage for these workers is $42,490. Nursing assistants are projected to add 262,000 new jobs. There will be many other job openings to replace workers in addition to these new jobs. The median annual wage for these workers is $25,100 a year. Lastly, on this slide, we have medical assistants, which are projected to add 138,900 new jobs, earning a median annual wage of $29,960. Here we have behavioral health occupations, including psychiatric technicians. These workers typically need a post-secondary non-degree award and a few years of clinical experience working in an occupation such as an LPN. Most states do not license psychiatric technicians. For those states that do license, technicians usually are required to complete an accredited education program, pass an exam, and pay a fee to be licensed. The American Association of Psychiatric Technicians offers 4 levels of voluntary certification for psychiatric technicians. Substance abuse and behavioral disorder counselors typically need a bachelor's degree, and some jobs require a master's degree. We chose to include this occupation in today's presentation because requirements vary. Requirements vary depending on the employer or setting, and there are positions available for workers that have less than a bachelor's degree. Regulation of counselors varies by state and by practice setting as well. with public settings having less stringent regulation generally than private settings. Looking at the data for psychiatric technicians, you can see that these workers are expected to add just 3,500 new jobs from 2014 through 2024. Median annual wages that these workers earn is about $31,130. Substance abuse and behavioral disorder counselors are projected to add 21,200 new jobs, earning a wage of $39,270. So our second to last group here with physical and occupational therapy occupations. PT assistants and OT assistants typically need an associate's degree. All states require a license or certification for PT assistants. Licensure typically requires graduation from an accredited PT assistant program and passing the National Physical Therapy Exam for physical therapist assistants, which is administered by the Federation of State Boards of Physical Therapy. Some states may have additional requirements. Most states require license or registration for OT assistants. Licensure typically requires the completion of an accredited occupational therapy assistant education program, completion of all fieldwork requirements, and passing the National Board for Certification and Occupational Therapy exam. Some states, again, may have additional requirements. If we look at the data for PT assistants, you can see that this occupation is projected to add 31,900 new jobs from 2014 through 2024, and these workers typically earn a median annual wage of $54,410. Occupational therapy assistants are projected to add 14,100 new jobs, and median annual wages that they earn are typically about $56,950. Our last occupation is pharmacy technicians. These workers typically need a high school diploma and moderate on-the-job training to enter the occupation. Less commonly, candidates may enter the occupation with a post-secondary non-degree award. These programs are usually offered by vocational schools or community colleges. Most programs award a certificate after 1 year or less, although some programs last longer and may lead to an associate's degree. Many states regulate technicians in some way. Some states and employers require pharmacy technicians to be certified. Even where it's not required, certification may make it easier to get a job. Pharmacy technicians are projected to add 34,700 new jobs by 2024, and they earn a median annual wage of $29,810. Here we have a link to the OOH website. So for more information about these occupations, as well as hundreds of others, we encourage you to go to our Occupational Outlook Handbook homepage and have a look. And now we're going to do a brief walkthrough of the website so you can get familiar with it and hopefully can help you in finding any data that you're looking for. So let's see here. Angie, can you see my screen?
I sure can.
Okay, great. So here we have our Occupational Outlook Handbook homepage, and you can search for occupations in a variety of ways. The search box up on the top left, or excuse me, right-hand corner functions just as a Google search engine. So if you know a specific occupation that you're interested in, you can just type it in there. We also
Emily?
Yes?
Emily, excuse me, this is Angie. Look, for me anyway, it looks like we're stuck on your home screen.
Let's see, there, can you see? Okay, great.
I can now.
Okay, wonderful. So I was just saying this search engine up here, you can just type in an occupation if you know what you're looking for, and it will pull up the appropriate job profile. We also have all of these drop-down menus here, so you can search for occupations by level of education, median annual wages, a number of different options. And then we have these occupational groups over here on the left-hand side. So if you select healthcare, that'll pull up all of the healthcare occupations for which we produce employment projections. So let's select LPN, and this will pull up the job profile for LPN. In this last cycle, we just switched to what we're calling a tabbed format, where we have these 8 tabs at the top of the page with different categories of information. So the Summary tab is obviously going to give you a brief overview of what you can expect to find throughout the whole profile. But if you start digging into the profile, you can see these What They Do tabs have a list of duties that the workers in this occupation typically perform. And then they're also going to have a narrative that provides a little more information below. Here we have the Work Environment tab. This is going to provide the level of employment in 2014, as well as this table here, which shows you the industries that the occupation is employed in. So no surprise, the largest employer of LPNs is nursing homes, with 38% of LPNs employed in that industry. So we also have data here about work schedules. So you're going to find information about full-time, part-time, shift work, that kind of thing in that section of the profile. Next, we have the How to Become One tab, which is where you're going to find information about those pathways that we just discussed. So all of the education, training, and work experience assignments, as well as any information about licensing and certification are available here. We also have a list of important qualities that students and career guidance counselors often say this is helpful in helping people to determine where they might be a good fit, if they're matching skills that they have or skills that they want to gain with an occupation. They can look at this section of the profile to do that. Most profiles also contain this advancement section, which is going to show data users information about what they can do to advance their career after they're already working in the occupation. So if we scroll back up and hit the Pay tab, here you're going to find those median annual wages that we just talked about. You have the median annual wage as well as the wages for the bottom 10% and the top 10% earners that will be reflected in every profile. You'll also have wage data for those industries that we discussed. So you can see here in this first row that LPNs who work in nursing care facilities typically earn $43,700. So they're earning more than LPNs who typically work in offices of physicians. So that data can help to inform job seekers and where they'd like to work. This chart over on the right-hand side appears in every profile. That's going to show the median annual wages for the occupation compared to the average wages for all occupations which we study. So you can see that the total for all occupations, that 819 number that I mentioned at the beginning of the presentation, was $35,540 in 2014. So you can see how that compares to LPNs. And then this middle level of data here is sort of the broad category where we classify LPNs. So this is comparing the LPN wages to the wages of other healthcare workers. Here we have the Job Outlook tab, which is going to reflect the projections data. So you see the 16% rate of growth that's mentioned, as well as the comparison to the average for all occupations. Again, we have a chart with the same levels of detail over here, with the 16% for LPNs being compared to the 6.5 here rounded 7% growth rate for all occupations. This tab is always going to include a narrative explaining the factors that are expected to drive employment growth or decline over the projections period. State and area data, we'll come back to this tab at the end. Similar occupations, this is going to include a list of occupations which are similar either in their duties or in the typical entry-level education, but we have links here to the corresponding profiles. And then the More Info tab on every profile has links to related organizations that might be helpful for additional information. So things like organizations that offer licensure exams are going to be listed on this tab. So if we go back to the State and Area tab, this is going to reflect data from the Occupational Employment Statistics Program, referred to as OES. And OES is where we get most of our data inputs for our base year employment count, which we use to calculate the projections data. So if we click this link here for LPNs, that will take us to the OES webpage for data for this occupation. And you can see it brought us right to this map for employment of LPNs. This is a pretty handy tool because even though we don't have projections for each state and area, there is base year data available for each state. So you can see if I hover over Texas here, I can see the employment of LPNs in that state as well as the median annual wages and location quotient. So that's helpful for many data users who are looking for more state or regional specific data. Let's see. If we go back to the profile, you can also see right here is the Projection Central. That's what I mentioned at the beginning of the presentation. You can find state and area projections data through their website. So with that, I think I'm coming up to my time limit here. Angie, do you want to take any questions now, or?
Yes, does anyone have any questions for Emily? You can either unmute your phone line by pressing *2, or if you muted yourself by your own phone system, or please feel free to type something into the chat box. No questions? All right, well that was fantastic information. I think a lot of us will be referring to your slides and your website to kind of refresh our memories and to dig deeper into some of the information that you provided with the prospective allied health professions that each of the networks are looking at. So thank you so much, Emily, for your time. We appreciate it. I think Emily is going to sign off, folks. So I believe her contact information was on her slide, but I will send that in an email following tomorrow as well.
Okay, thank you for having me. And as Angie said, my contact information is on that slide, so feel free to call, or if you prefer to shoot me an email, I'm happy to walk you through the data we have available.
Wonderful. Thank you so much, Emily. We appreciate it.
Thank you.
And our next speaker is Stephanie Laws, and she is the Executive Director of Rural Health Innovation Collaborative in Indiana, and she is going to share with us some of their student recruitment or best practices or the way that they outreach to students. So I will turn it over to you, Stephanie.
Thank you, Angie. Can you hear me okay?
I can.
Okay, great. Well, welcome everybody to today's webinar, and as Angie mentioned, my name is Stephanie Laws, and I am the Executive Director of the Rural Health Innovation Collaborative here in Terre Haute, Indiana. You can find us on our website at www.therhic.org at any time. So the Rural Health Innovation Collaborative is a 13-member public-private sector non-for-profit. And on this slide, you will see our very diverse partner base. We have a mix of academic focused institutions. The Indiana Rural Health Association, which is a great partner and leader here in the state of Indiana, as well as the Community Behavioral Health Center, our local area health education center, as well as the state AHAC. And then, of course, as you heard from the previous presentation, how all of this leads to economic impact, right? And so we have the City of Terre Haute as well as our Economic Development Corporation as a collaborative partner. So we are very excited to have these organizations coming around the table to really focus in on what can we do in that healthcare sector space to really add value not only to population health management outcomes, but also to stimulate student recruitment, retention in and around our rural settings. So the Rural Health Innovation Collaborative is focused on community health and wellness, interprofessional education and practice, as well as economic vitality through a well-trained, highly competent and confident workforce. Sometimes in rural communities, you can expect that a critical access hospital sometimes may be the largest employer in those areas. Therefore, being able to provide not only the clinics that are hubbed around the critical access hospital, but the critical access hospital themselves with a steady pipeline of not only professional practitioners, but allied health professionals is a very important endeavor. We have, at the heart of the Rural Health Innovation Collaborative, is our only state-accredited simulation center. We are accredited by the Society for Simulation in Healthcare, and we have over 25 healthcare disciplines that utilize the Simulation Center, many of which are allied health profession students. Ivy Tech Community College, as well as Harrison College, but primarily Ivy Tech Community College is our engine for not only our community connection for recruitment of allied health professions, but also a great partner as it pertains to some of the grant work that the Indiana Rural Health Association is taking the lead on that we'll learn about a little later in the presentation. But here on this slide, you can see that we have the EMTs and paramedics. We have there in the lower right-hand corner, we have the diagnosticians in terms of the ultrasonography and radiography students. But we also have other, you can see in the mass casualty situation there in the bottom middle, where we are working with many sectors of response around the healthcare needs of our community. And so we really try to foster and offer a training opportunity that not only stimulates interest in around allied health professions recruitment, but we also try to offer some of these interprofessional educative experiences that really solidify these allied health profession students into their career choice and their field of choice and prepare them to be successful once they find employment within their communities. One project that we had started about 2 years ago was a supportive program around accountable care organizations with our local extended care facilities. Obviously, while we're sharing information today about some of the programs we do, we hope that you can take these ideas and potentially replicate them in your own communities to be successful in the strengthening your allied health professions pipeline. And so this project was specifically geared towards those supportive personnel, whether it be paramedics, phlebotomists, nursing assistants, and medical assistants, to go out to 4 extended care facilities, and we had a very structured program where they worked with the elderly and with the providers at this facility so that we could mitigate opportunities for these patients to be readmitted. So we kept them in the facility, we helped the hospital, and then we also offered experiential opportunities to our students in a way that really landed them not only the rapport and connection at the end of their experience with these facilities for job placement, but we also received great reviews from our students in terms of thinking outside the box and providing them with immersive experiential learning to help them be prepared for the workforce. We also work with our Indiana Rural Health Association, our March of Dimes, the State Department of Health, to really look at bringing in these interprofessional teams, especially around the licensed practical nurses, the emergency medical technicians, also the respiratory therapists in cases where they are working in rural critical access hospital emergency departments, and we have issues where we have high-risk, low-volume emergencies, and so we help to provide programming around them staying and retaining in these areas to prevent cognitive decay and improve their functionality in terms of taking care of at-risk patients. And so this is one example of how we're partnering with our RIC partners, the Rural Health Association, AHEC, and March of Dimes, for example, to help them be successful in their career space. As I mentioned, Ivy Tech is really one of those huge engines for creating a pipeline of recruitment and retention of allied health profession students into our pipeline. They actually have a campus here in the Wabash Valley, but here in the Southwest and Wabash Valley, we have started what's called a College Connection Coach Program. The College Connection Coach Program provides guidance and support to high school students to help them explore future career and college opportunities. Obviously, not every student is able to go on to be a physician or a doctor of osteopathy or a forensic scientist. And it really helps them through this program to be able to provide transition service, assistance with their admissions application, looking at financial aid, conducting college visits. They also provide assistance with exploring careers because a lot of our rural students that comprise our rural communities here in Indiana don't really have that career path in mind. And so with the assistance of the College Connection Coach, they offer development of an academic and career plan. They offer free group workshops on career planning in college. They do in-class preparations on career and college readiness. They assist in reviewing Indiana Career Explorer assessment results. And they also have information about dual credit classes where they can start earning credits toward their degree at Ivy Tech while they're still in college. And for a lot of students that are exploring careers, they are uncertain what to do after high school. They're thinking about signing up for a dual credit class, but they're not sure what to do with those college credits if they've actually earned them. They just need assistance. And so Ivy Tech has really stepped up to the plate in our region to foster that enrollment growth and increase retention rates among their students through this College Connection Coach Program. And we have seen an uptick in our allied health professions enrollment in the Southwest and in Ivy Tech Wabash Valley. So this was just a tremendous opportunity that we were able to demonstrate to all of you today about how this community college is able to really escalate an awareness among our kids and our high schools and make that local connection to fill that pipeline into college. The hallmark of our efforts is led by the Indiana Rural Health Association. The Indiana Rural Workforce Innovation Network has 3 key focuses: recruitment, retention, and obviously replication. Many hospitals and clinics and physician practices in rural areas face tough challenges in attracting and retaining key professionals. Healthcare operations require a full complement of allied health professionals to offer quality care and secure, satisfying outcomes. Finding, training, and retaining key allied health profession personnel remains a top priority. The Indiana Rural Workforce and Innovation Network, or IRWIN as it's called, is dedicated to improving the quality of healthcare services and strengthening the rural healthcare system in Indiana by improving the recruitment, clinical training, certification, and retention of these allied health professions in Indiana. This program, as I mentioned, includes direct partnerships with the Ivy Tech Community College, Rural Health Innovation Collaborative, and our lead bridge organization, the Indiana Rural Health Association. It is our intention to establish a sustainable and replicable model of training for allied health students in rural areas through a mature network of rural hospitals in partnership with Indiana's community college system. We also want to encourage allied health students to explore opportunities in rural settings and train students in these settings through incentives to participate in didactic education in rural culture and hands-on clinical training through apprenticeships with rural host sites. We also want to ensure through our collaborative plan that the participants of this program seek and secure employment in rural settings with industry-validated credentials. I would be remiss to let you know that this project is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services under the Rural Network Allied Health Training Program. It is funded 100% by HRSA, but now that we are moving into year one of our grant, we are very hopeful that we will have results to share on a national level within the next year. We anticipate that we will have our first cohort of enrollment of these allied health profession students to this program in the fall of 2016. Students will be exposed to a very focused rural curriculum in which they learn the dynamics of rural healthcare and how to navigate the multiple informational aspects of what is rural, how am I rural, and what do I expect. Also, through the great network through the Indiana State Rural Hospital Network and the other constituency-based services that the Indiana Rural Health Association offers, we are able to match clinical training sites for our students in our first year, focusing on medical laboratory technicians and ultrasonography technicians. Obviously, the intention of the program is to offer it to all of the health science allied health professional programs that Ivy Tech offers as an elective opportunity to help improve the knowledge of rural and the importance of education, recruitment, retention, and replication throughout the state. So the next steps are for us to be able to measure the success of our program. As I mentioned, we have a lot of different activities that we do locally. We start early. We work on field trips by introducing students anywhere from the K through 6 age to expose them to various healthcare opportunities. We partner with local partners such as the Children's Museum to expose students to a wide variety and range of also those health profession students. Then touching them again in high school with that College Connection Coach Program, and then by enrolling them in our Allied Health Professional Irwin grant that is a strong partnership between Ivy Tech, the Rural Health Association, and the Rural Health Innovation Collaborative. Obviously, we have a lot of work left to do, as evidenced by the Department of Labor presentation that showed the gap analysis of future projections for allied health professions in the future. And with that, I will pause and open it up for questions, comments, or feedback.
Thank you so much, Stephanie. Do we have any questions for Stephanie about any of the things that they are doing in regard to student outreach? And you can unmute your phone lines by pressing *2, or you can use the chat box. Looks like we may have a question coming in. So Janice from Union County says, do you have any resources for federal scholarships for your students?
So as part of our Health Resources Services Administration grant, we have built into our budget initially for these cohorts to have scholarship availability. The team of partners have really sat down and determined what are our eligibility requirements, as well as how students can compete for those dollars in that realm. So yes, initially we have set forth some scholarship funds to incentivize the program.
Thank you. Any other questions? And if there aren't any more right now and something comes to you